From the News Channel 5 Network, this is Morning Line with Nick Barris.
Good morning, everyone. Thanks for joining us on Morning Line. Nick Barris here with you on a Tuesday. It is 8 o'clock, and I am very glad you're here. We're going to talk about, a topic that either may apply to you right now as you sit there personally, or it may apply to a loved one of yours who is getting up there in age. Now, we've had Tim Takis, of course, before on, and Barbara McGinnis, our elder care attorneys. They deal with the legal aspect of it. But, the more tangible aspect of finding a way to pay or finding a way to locate somewhere to live when perhaps you can no longer live at home, or find a way to allow yourself to stay home longer even as you're on a fixed income and you're running out of money. The problem here in Tennessee, and frankly nationwide, is there's a crisis in home and community health services, based services for the seniors that are out there. And there are organizations here in Tennessee trying to look at ways to get more federal money to help people with this issue. And as I say, I'm dealing with this with my folks right now. We've dealt with it. And, especially if you're dealing with older, Americans and their children, it doesn't really hit you until later. And sometimes it's too late. And then you're scrambling to deal with a crisis situation. The best way is to think about it now ahead of time. We're going to talk about it with two great guests with us, Tennessee Coalition for Better Aging, and Grace Smith also with us, and we're going to introduce them right now. There's Grace up top, okay? She's Executive Director of Age Well Middle Tennessee, and then Dr. Jim Powers, both of them associated also with Tennessee Coalition for Better Aging. Thank you both for coming on. And, before we get to any phone calls, and, I just want to start broad-based here. Maybe I'll give you each a chance. We'll start with you, Grace, to just tangibly explain to us what type of crisis we have right now in home and community services in Tennessee for the aged. Give me a snapshot of how bad it is.
Well, I'll start by saying that the older population in Tennessee is essentially doubling by 2030 from where it was in 2010. So with our population, older population growing, baby boomers certainly are here. The population is growing rapidly, and our systems have not kept pace in order to help support older adults, particularly as your health starts to decline or you need more support day to day. And so that has really, in COVID, has really ripped any of the Band-Aids off and shown us the weaknesses of the system that we have in Tennessee. And we know that family caregivers are the backbone of our long-term care system, yet Tennessee ranks 49th among all the states for support of family caregivers.
Wow.
We have to do better to support families and to help older adults age well throughout their lifespan.
And Dr. Powers, I'll let you piggyback on that, but when she discusses aged or people aging, what age are we talking about now? Now you hear, 65 is the new 55. So what is an aged population now, as she refers to it there?
In general, we talk about people age 65 and above because that means Medicare. But we realize that many individuals with chronic illness can be much younger and be very frail and very needy of services. Just look at the disability population. But it is true, as we get older, 75, 85, we accumulate more diseases, more need for assistance, and more caregiving issues also accompany that.
Okay, so that population you've said is increasing. And so the crisis then, is it that there is not enough places for them to go or not enough services available? As I think we'd all agree, most want to stay, for better or worse, frankly, at their own home. Not everyone's capable of that. And so let's hit the two of them first. Let's start first with services available to help allow folks to stay in their own homes for a longer period of time as opposed to going to assisted living or a nursing home, Grace. So what's the situation there?
So some of the main problems with the system right now are that there is a direct care workforce crisis where we don't have enough workers who are providing in-home direct care. It's very hard for the agencies that provide that type of in-home care assistance to find and retain workers. When you look at what's driving that crisis, there are two main things. One, we're not paying those workers a livable wage.
Yeah.
it's hard work, and in order to attract them to that profession and keep them in that profession, their pay needs to increase. But in order for that to happen, reimbursement rates to the agencies need to increase as well. So, you know, there's a scaffolding out there of services, but there are a lot of problems related to workforce right now.
Well, and if you would, just so we're clear for folks, I mean, when you talk about reimbursements to these agencies, okay, if a senior needs, say, nursing care to come in a couple days a week, maybe to help, and maybe a service to help neaten her house and tidy it up. All right, I mean, if they're able to, you know, the individual's supposed to pay for that, right? And if they're not able to, they're on a fixed income or their monies have run dry, where is that money supposed to come from? We all know Medicaid does not pay straight up right off the bat for nursing home care. So where's that money supposed to come from?
Well, Dr. Powers?
You are quite right that those services are generally paid for by families. And when families cannot hire outside help, they therefore have to do that themselves. And we're finding that a lot of relative caregivers are staying home from work. They may be employed, they're leaving employment, or if they are still employed, they're just worried about mom and dad at home all of the time. And they're having difficulties. We hear this from HR directors all of the time. And Tennessee actually is 49th, as Grace mentioned, in terms of support for caregivers. There just aren't a lot of programs out there to help. Many other states have very, very interesting and I think very helpful models about how we could go forward. And such funding as is coming to Tennessee, or potentially to Tennessee, $157 million through the American Recovery Act program, could help fund some very innovative projects that I think could help many, many people, particularly the working poor who might not have Medicaid even.
Okay, yeah, and you say working poor with Medicaid. Let's touch. Now, I did mention, you know, folks want to stay home. Now, as far as those individuals, and I mentioned to you before the show, and I've talked about it before here, my parents, you know, they live in Idaho, and they are now in an assisted living facility in Boise. They're in a place now where at some point, okay, they're going to run through their savings. Now, of course, my brother and I will always be there to help them if they need it, but they've chosen to go to a Medicaid qualified facility, which is what we were looking for when we wanted them to. Now, I understand that same type of thing can happen in Tennessee. I don't know how many they are. There aren't a bunch, and we need to explain to folks what that means. The way I understand it with my folks, they're in a Medicaid qualified facility. They've been there and have been paying, okay, about $6,000 a month for the two of them to live in this facility, okay, for the past 3 or 4 years. When they run out of their life savings and have nothing left but their Social Security, okay, and we have an attorney that's dealing with this for us, they will apply and it will kick in, and Medicaid will pick up the remainder of the tab for as long as they live in this assisted living facility. Now, one reason is they're in there and have been paying all along, so when they finally run out, they're there and this company is going to pick it up. Now, my understanding is very difficult to get into that situation, especially if you're from the outside looking in. So does the same type of thing exist here in Tennessee?
Medicaid, so it's confusing to understand Medicare versus Medicaid. So Medicare is the federal insurance program, and a lot of people assume, oh, well, Medicare will just pay for that. The truth is, when it comes to long-term care, Medicare pays for certain things, usually time limited, whether that be home health that a doctor has ordered, so some in-home care, or care in a nursing home following a hospitalization. So for rehab, up to 100 days. That's Medicare. It's time limited, and it's usually for a specific medical or skilled need. Medicaid is a state program that does receive federal funding, so it can vary from state to state. What your parents have in Idaho is probably different from what we have here in Tennessee. And Medicaid in Tennessee is called the Choices Program, and there are different components of that that are designed either to support someone in a nursing home, or if they qualify for nursing home care, to provide home and community-based services as long as is possible. One of the things that the Tennessee Coalition for Better Aging has been advocating for is the need to open up the Choices 3, Group 3 eligibility. Because as it stands right now, several years ago, Tennessee made that a lot more restrictive to qualify for. And so the income restrictions, you basically have to be on SSI, supplemental insurance, a very low income program in order to qualify for Choices 3 to get a minimal level of home and community-based services. There are groups like Age Well Middle Tennessee, Tennessee Disability Coalition, Tennessee Justice Center, many others that are part of the Coalition for Better Aging. And one of the things we have recommended to TennCare for use of this influx of federal dollars is we need to open up Choices Group 3 again to make more people eligible to receive home and community-based services and not be so impoverished in order to do that. A lot of this, Nick, is driven by financial issues and people who either haven't been able to save up enough for retirement or they're outliving their savings. Mm-hmm. And so we have to create ways. Private sector would love to tell you about some of the model states we've looked at as we've done this work. So it needs to be a combination of government, public programs, but also private sector solutions that can help meet this need.
Some phone calls, and let's take a quick break. We'll take a quick break because we're up against it. When we come back, I'll let you sound off there as well. And we've got some calls. I want to continue talking about exactly what you were discussing right there, just ways to make it more affordable. And frankly, what happens to folks right now when they are in a situation of need and can't get that help. It's very depressing what happens to some of these families. We'll take a break and be back with more right after this.